125,543 negative test results. 245 deaths, which is an increase in 2 since this past Friday. The cluster information, we have 165 clusters that we've worked. 76 are closed now and 89 are active, which have accounted for 5,740 cases and 173 of the deaths. There's 5 of the broad areas that have accounted for about half of the cases and 2/3 of the deaths. Corrections, we've talked about before, 4 clusters, 1 of which is closed, 1,026 cases and 7 deaths. Gatherings of various kinds, 17 clusters, 10 of which are closed, accounting for 201 cases and 13 deaths. Long-term care facilities, 39 clusters, 19 of which are closed, 803 cases and 131 deaths. Meatpacking with 11 clusters, 1 of which is now closed, 2,939 cases with 13 deaths. And private industries, 78 clusters, 36 of which are closed with 649 cases and 6 deaths. I talked last week about a county jail, and they put out a information release from the Geary County Jail, and I wanted to talk about it briefly because it's an example of how things go right. And we've had actually quite a number of things of situations like this that have gone right, but this is emblematic, I think. It was on Thursday, a week ago Thursday, in the evening, we found out about a case, an illness in one of the law enforcement personnel. The next morning went in and did testing of every offender and every one of the staff in the Geary County system. And by the next morning had the results on all of the tested individuals. We tested 140 staff and inmates, ended up having a total of 5 positive test results, and 3.6% therefore were positive. We will go back now on Wednesday of this week and we'll test all of that same cohort of 140 again. Anticipate the test results will show that the disease has been contained. This is excellent news and a testament to how swift work to address and contain the virus, and it was a very successful outcome. It shows the cooperation between the facility, of course, and the jail and the law enforcement community there. The county health department responded terrifically, as did my own agency, KDHE, and especially the lab. We are working in a similar situation right now. We're just getting information today on it, so I'll talk about it later in the week, which is similar, not in law enforcement or corrections, but an industry. And we are today finishing up the testing of 500 individuals, and we've had 10 positives come from that group. But again, it shows the rapidity of response, which we've talked about the ingredients for success all along, and that is having adequate testing, adequate staff, adequate contact tracing, and that's the mixture that we're seeing come together now in a very productive way. And again, Governor Kelly talked about the map, which, by the way, is available on our website. A couple things to remember about this. One is that this is a brief snapshot in time. At the minute it's printed, it's probably minimally out of date, but it's still directionally correct, okay? So it's a snapshot in time. The colors mean something, and we have handouts over here for you to take if you wish. The blue is the phased or modified ad astra plan that the governor talked about. The brownish colors here, county-specific reopen plans, which could, by the way, mean no reopening plan, meaning back to business as usual, the doors are wide open. And then the green ones are no other reopening plans in place, which means no other reopening plan other than the ad astra plan for, as Governor Kelly discussed. A couple counties we have no data. The crosshatch counties have no cases, at least that have been identified in those counties. And I will point out the statistical lesson for the day is, of course, that in a small or low population county, even having a couple cases pop up could make it go from favorable to unfavorable. In other words, small numbers can affect small counties, but the Sedgwicks and Wyandottes and Johnsons, it takes a good number of cases to cause the inflection to go from favorable, i.e. green, to unfavorable in red. And to the governor's point with Sedgwick County, I've been, even through the weekend, working with the county health officer there, Dr. Munns, who's a very good colleague, and he has the same concerns that we do, and is working hard with leadership and with the medical community to do what they can do to contain it there. So I think this map is helpful, and it'll be changing regularly. I'd like to thank Kansas Division of Emergency Management. They're the ones that keep track and gather this information, and so it allows us to depict it this way. I've said it before, and I think it bears repeating, you are your own preparedness. Just because a county opens up doesn't mean you have to necessarily change your safety behaviors. I think also in some counties, for example, really pick any county, if it's a red arrow, it's going the wrong direction, that people should not feel, even if their county leaders choose to advance and open up the county completely, people still need to maintain their own safety behaviors. Okay? I forgot to mention that this means that they're just flat. They're plateauing off. So in summary, I think you can see from the graph, one, it's helpful to find out where are we strong, where are we weak. As a state, as the governor points out, we're strong. We do have threats. Our neighbor to the south, Oklahoma, is seeing a huge increase in their activity. That's also true on the Missouri side. Not so much so on the Nebraska and Colorado side, but we cannot remain an island if the states around us continue to have an uptick in cases. That's why people need to depend on their own individual behaviors when it comes into these times when we will be discussing things like county fairs and the like. That's it in my prepared comments.
Are you going to be stepping into some of those counties where the arrow's going up, or like Central County?
We always work with the local health departments. We're always happy to help out in consultation and enhanced testing. And it's especially true, Martin, when there's an outbreak, because sometimes it can be just a general increase of community spread. But if it's a single outbreak that demands increased amount of testing and contact tracing, then we certainly would be involved in that. So the answer is yes.
But you're not going to step in yet and issued any orders?
No, there's been no orders issued. Everything, the county health departments have been very receptive. They've been quick to ask for assistance when they need it.
Governor, did you have any thoughts on the Supreme Court's ruling today on protections for LGBTQ workers?
Yes, I was delighted that they ruled that way, and and put an end to any discussion of the ability to discriminate against folks in the LGBTQ community. If you remember, that was the very first action that I took when I got into office, was to put back into place the executive order that did not allow our agencies to discriminate, and so I'm glad to see that it's gone nationwide.
What do you think chances are tomorrow for your initial list of federal COVID fund distribution? Do you have a good feel for that? Or?
Yeah, I think what the State Finance Council will be dealing with tomorrow really is the shifting of some of the CARES funding from the state account into our county accounts. It's Sedgwick County and Johnson County have already gotten their funding. It came directly from the feds because they hit the 500,000 population thresholds. The other 103 counties, need to wait for us to get it out to them, and we're trying to do that as quickly as we possibly can. But we base the amount that we'll be sending on what Johnson and Sedgwick got, sort of on a per population basis.
You feel confident that they'll approve this first $350 million chunk? Or?
I've worked with the legislature a long time, Martin, and I know that I can never say never, but I can't imagine that they wouldn't just go ahead and approve this. because it will directly impact 103 counties and all of their constituents.
Secretary Norman, is there something this map should be telling the average person? It seems like there are reds and greens and greens and greens, and it seems like maybe the average person might think a reopening plan didn't impact if an arrow's going in the right direction or not.
Yeah, I think it's a really good question, Alec, and I think the answer is we will really know over time. This is a 14-day snapshot. So it's one point in time, 14-day snapshot, and some of these, and as the governor pointed out earlier, some of these changes in terms of their plans have only just recently been changed. And I think when we get more, 7, 14, 21, 28-day increments, it'll become a lot more, because you're asking, is it cause and effect yet? And I just think it's too early to know that. I think it would be conjecture on my part. I'm quite certain that in aggregate, it's been successful, and the reason is because we can look at numbers and compare to those states that have not done that. But I think when you drill it down on a single county by county basis, it would be a little bit conjecture at this point. We'll know more.
Can you talk about Oklahoma? I mean, are you worried about people moving over the border, and what is a bad sign that we're seeing in Oklahoma?
It's just that they're going up in both sector-specific outbreaks and in general disease transmission, community transmission. So that's kind of the double whammy. Back to your question about here, it's easy to see the worst ones still remain the population centers and then those three specific sectors of corrections and nursing homes and meatpacking plants. I think what this will really help a lot with is if there's some kind of an outbreak on community spread that's in a rural area that's been minimally affected, that'll start showing up on the radar screen now. And that allows us, because I gave 2 examples of hotspotting with Geary County that did such a great job, and then the one we're working that we'll talk about next time. That way, it's part of an early warning system, but I want to get at that question of cause and effect and see what really makes a difference.
Dr. Norman, the government did suggest there was a cause and effect relationship between when Sedgwick County opened up
Yes.
and the result we're seeing there. So
Yeah, and we'll get...
individual counties, it's conjecture. Are you in agreement with her?
Yes, absolutely in agreement. And the reason is because it's a populous county, and you see the cause and effect relationship more quickly.
And you would attribute the uptick there to reopening too soon?
And in a rather unrestrained manner, yeah. Meaning that through contact tracing, we know that people have been to, and this is true with protests, Lake the Ozarks, bars and restaurants, especially bars. When people congregate and it shows up in contact tracing, we find out that it is related to those things that would have in other counties been closed.
I just want to make sure I understand what you're saying. You're saying the uptick was attributable specifically to people from that county attending protests, like in the Ozarks, and bars, or segregated?
I mean, in different areas. I was referring to those three things in different areas, yeah. But that's the right ideology behind it, yes.
Secretary, now that there are more tests being made accessible to the public and more different types of tests, such as the antibody test, do you think that we can trust those results that are coming out? How accurate are these tests, would you say?
We are still validating the serology. We know that the IgG, which is the longer-term antibody that's done on the blood test, is valid in our lab. We know that some commercial labs have serology testing, and it is valid for the COVID-19 specific virus, we'll say. So we've moved beyond that concern about the common cold virus, coronavirus, and have a good deal of comfort with that. There are still concerns about the Abbott, the rapid test and you heard about it in the White House, and for that reason, for example, if we have a person that's ill or has any symptoms, and we do the rapid test, if it's negative, we always pair it with the other PCR test, because we don't want a false negative to slip through our fingers.
Dr. Norman, is there a way for us, the governor referenced 21 states where the
Counties.
infection rate was going up.
Oh, states, I'm sorry.
Yeah, where there were concerns that, where does Kansas fit into the bigger picture? Is there any data, any particular statistic that would help us place Kansas in that continuum?
Yeah, there are quite a number of places that do that, and I refer to them commonly. I'll bring those references next time and share them with you, because And it's interesting, Jim, some of the darling states, Alaska and Hawaii, which are rather isolated, that had very low number of cases, they're going up now. And it is some of the earliest states, particularly California and Florida, that started to go down, they're starting to go back up again as things reopen. And it's very much a moving picture all the time. But there are those out there. There's quite a number, probably a dozen different sources. And my staff and I will sift through and come back with some recommendations as to the best one. We've had very favorable numbers. We can always get better, and we're not the most outstanding state in terms of cases per 100,000 population, but we're darn good.
Governor, Mr. Secretary, some states are canceling state fairs. Ours is a few months off. But if you guys could offer maybe even a political, but also a health review of having tens of thousands of people there.
Yeah, actually, Tim, we just had a conversation earlier about state fairs, county fairs, and other venues that might attract thousands of folks. And we will be gathering data information and providing guidance to those kinds of events that, if it's possible for them to open safely, what could guidelines be? You know, we did that with hospitality industry. We did that with your barber and your hairdresser. We got the industry guidelines on how to do it safely. And so we're looking right now to find those, if those exist, and then we'll put them together in a package to guide our state fair board in decisions that they might make, and then drop that down to the county fairs, and then any other kind of event that's likely to draw crowds from far and wide.
Madam, for Regents, should President Golden stay at Wichita State University?
Could you say that again?
Pardon me. Should President Golden stay at Wichita State University?
I think that is a decision that is up to President Golden.
Not the Board of Regents?
I think that they've already spoken.
One more question?
Dr. Norman, KU today announced that they've shortened their fall semester. They're going to really emphasize testing and contact tracing when students come back to campus. And part of that they mentioned was a partnership with KDHE. So how far along is that planning process? What does a fall semester with 30,000 people in Lawrence look like?
Yeah, it's, and we have met with the leadership and also with the KU Health System as well, who provides consultation and direct services, working with the Lawrence Douglas County local health department and then the Student Health Center. And it is a daunting task, there's no question about it, that many students coming to campus. I think what they are doing is looking into our collective crystal ball and say, what is the trajectory of the illness curve going to look like for the fall? And we do believe that it'll be more favorable early. Then I think it makes a lot of sense to adjourn at the Thanksgiving break and for people to clear out, because it goes back to Tim's earlier question, gatherings are still problematic. There's no question about it. They're doing a lot of the engineering things. They're doing a testing strategy will be put in place. It has profound impact on the chow halls, the dorms, and so I think there's going to be a lot of attempts to minimize the to keep the social distancing and other things in place.
Thanks, guys.
Yep.
Called dining, it's not chow.
Oh.